I knock on my patient's door, they let me enter, I do my hand hygiene, I'll introduce myself. Good morning, my name is Claudia. I'm going to be your student nurse today. And today we're going over the lung and thorax portion of our assessment. For the first portion, I'm going to ask my patient just 2 questions. Have you been experiencing any shortness of breath?
Nope.
No. Have you been experiencing any shortness of breath for the past few days?
Nope.
No. Okay. My next question is, have you been experiencing any chest pain while you're breathing?
Nope.
No. Okay, great. So the next part of our assessment, we're going to go on to our inspection part. I'm going to take a look at my patient's respirations. I'm going to note the rate, which is nice and normal. If I count to a full minute, I can see that my patient is at 18 breaths per minute. I'm going to go over the respiration pattern, which is nice and even. It's nice, even, and regular. After that, I'm going to go just inspect the chest for any bulging or abnormal abnormal retractions in the chest, which my patient does not have. Also, I can see that my patient is sitting in an upright position, slightly leaning forward while breathing, and chest expansions are nice and symmetrical. My patient's skin is nice and pink. There's no signs of pallor or cyanosis. I can see that my patient's anterior-posterior ratio to transverse is 2:1. So after my inspection portion, I'm going to go over to the palpation portion, and I'm just going to go over and palpate the anterior of the chest here. We're palpating for any tenderness, any lumps, any abnormal bumps. We're going to go over to the transverse side. We're going to palpate for any lumps and bumps. We're going to do the same on the posterior. Palpating for any tenderness. We're going to do the same on the other transverse side. So we've palpated, and then after we're done palpating, I'm going to ask my patient to turn around. I'm going to look at the back side here, and I'm just going to make sure that my patient has equal chest expansions, and that the chest expansions are nice and symmetrical. So how I'm going to do that, I'm going to cup my thumbs, kind of my hands around my patient's back like this, where my fingers are touching the spine. And when my patient breathes in and out, I want to see that my fingertips are slightly going in and out symmetrically. So my patient's chest expansions are symmetrical. So you can turn back around. For the next portion, we're going to be going over our auscultation. So I want to start off by cleaning off the diaphragm of my stethoscope. And we're going to be listening for full breath sounds. On the anterior side, we're going to start off by auscultating at the trachea, and we're going to auscultate side to side on our 5 fields. So let's see here. And I'm going to have my patient breathe out through his mouth a little deeper than usual. And again, I'm going side to side. and I listen for a full breath sound on each side. I'm also going to listen to my right transverse side. And we have 3 lobes on this side, so we're going to listen in like a triangular form. Okay, and I'm going to auscultate the left lobe, our 2 areas. And then I'm going to auscultate the posterior side on our 9 areas. And I want to auscultate closer to the spine and away from the scapula so that we can get a better sound. And again, we're going side to side, listening for a full breath sound, for any abnormal sounds. Okay, and my patient can turn back around. So over our trachea part, we were able to hear our bronchial sounds. Over right here in the middle area in between the scapula, we were able to hear our bronchovesicular sounds. And in our peripheral areas here and in the back, we were able to hear our vesicular sounds. And that concludes my lung and thorax assessment. Thank you.